Hi, my name is Melanie Mora, and I'm going to talk about Frey syndrome. Definition: Frey syndrome, also called lucid sweating or auriculotemporal syndrome, comprises facial sweating and flushing appearance in the parotid region, in the areas innervated by the auriculotemporal or the gray auricular nerves. Applications in medicine: Frey syndrome is a benign and little-known entity, which is why it is considered underdiagnosed and often confused with other pathologies, especially food allergy due to its relationship with intake. In Frey syndrome, a gustatory stimulus simultaneously activates the salivary glands by the parasympathetic system and also erroneously the cutaneous vessels and sweat glands by the sympathetic system, producing the facial erythema and hyperhidrosis that characterize it. Frey syndrome occurs due to the injury to the temporal atrial nerve. Among the different causes that can injure this nerve: accidental wounds, surgical injuries, suppurative wounds, and severe fractures of the temporomandibular joint. And in fact, Frey syndrome is a benign and self-limiting condition. Therefore, the only recommended treatment is the correct information from the parents in order to maintain an expectant attitude until its disappearance. This is the passage of time. In children, symptoms tend to improve over time and may even disappear. In adults, the most effective treatment is perineural infiltration with an alcoholic solution or partial removal of the nerve. Conclusion: Frey syndrome is a phenomenon that can occur as a result of various actions, several of which can be derived from surgical procedures that take place near the part of the temporal atrial nerve. Therefore, it is important for the clinician to know the anatomy in depth, or decide to carry out the procedure to avoid making undesirable side effects.
Hi friends, this is a syndrome related to the food. When person eats something along with the release of saliva in the mouth, sweating on the cheek area near to the ear occurs. Here it occurs on the forehead region. I gave my lens to eat to him and you can see the sweating on the forehead. Thus, this can easily be diagnosed by giving lemon to the eat, and other diagnosis can be made by the iodine and starch test. This is also known as auriculotemporal syndrome or Bale-Larger syndrome and Dupuy syndrome or gustatory sweating. The main cause is the haphazard growth of the nerve fibers, as you can see in the diagram. And the treatment is the local application of anticholinergic cream or ointment like scopolamine and or glycopyrrolate or clonidine. Or the surgical cutting of the fiber is the temporary treatment, and giving the botulinum toxin injection helps a lot. Thank you for giving your valuable 1 minute.
Frey syndrome is something that happens after a patient has parotid gland surgery. A lot of my patients ask me to explain to them what is Frey syndrome. So we created this animation to try to take a relatively complex topic and simplify it and explain it. Anytime you remove a part or all of the parotid gland, it's called a parotidectomy. Now, why do we do these parotidectomies? The most common reason is a person has a tumor. This is shown here by this yellow sort of glowing mass. Another very common reason that parotidectomies are performed are for parotid inflammation, usually chronic in nature. The parotid gland, the purpose of this gland is to produce saliva, and it's under the control of the brain via very special nerve fibers that are attached to the parotid gland. Here you can see the small blue vesicles moving that represent the saliva flowing from the gland through the duct into the mouth. So as the brain sends a signal down these special nerve fibers, it stimulates that gland to produce saliva. When a parotidectomy is performed, the gland is removed, but those nerve fibers remain under the skin, even though there is no gland there. Now, these nerve fibers that were originally attached to the salivary gland now look for a new home, and they look for the sweat glands of the skin. So when now the new patient is saying, I'm thinking about eating, and the idea of a burger or ice cream comes up, the brain says, great, make some saliva. It sends the signal down those nerve fibers, but now it stimulates the sweat glands instead of the salivary gland, because these nerves have reattached themselves to a new type of gland, your sweat gland. The patient will feel warmth and maybe moisture as they're thinking or actually eating food. And this is actually what we call Frey syndrome. Now, the degree to which a person feels this will vary from person to person. But that process of sweating on your face or having redness or warmth while thinking of food, that is called Frey syndrome. The good thing is that with proper reconstruction, Frey syndrome can absolutely be prevented at the time of surgery.